Welcome to Hello Doctor Talks. Today we are going to discuss about acne, and to discuss more on this we have with us Dr. Karnal K Prasad. Dr. Karnal K Prasad is a dermatologist, aesthetician, cosmetologist and venereologist of vast experience of more than 35 years in the specialty and alumnus of the prestigious Armed Forces Medical College Pune. He served in the Army Medical Corps for more than 33 years. Presently Head of Department Dermatology, Medicity Institute of Medical Sciences, Medchal, Kanpur, Hyderabad since 2012. Doctor, what are pimples or acne?
Pimples, or acne as we call them, are a very common condition which primarily affect the young people of growing age. They start appearing when the person attains puberty. However, it is to be noted that acne affects almost 95% of the world population at some time during their life. The primary cause is the hormonal changes which occur during the puberty. As the woman or man start coming of age and they develop the secondary sexual characters. That is the time, due to the hormonal changes, the oil producing glands of the skin, they start enlarging. If you see in this picture here, this is a schematic diagram of the skin showing the hair follicle and the sebaceous glands in the concavity. And these are both the sebaceous glands, like grape-like structures. These are the glands which start producing more oil during the puberty due to hormonal changes. And when this hair follicle gets clogged because of exfoliating skin, etc., the sebaceous glands gets collected, it enlarges, and that is what causes pimples. Furthermore, there are certain bacteria which are normally resident on the skin. These bacteria infect the oil and then it causes inflammation. The whole process, first the clogging of the hair follicle, the enlargement of the sebaceous glands, the infection, all this, and then it forms an inflammation. Initially, it's what we call as a closed comedone or a whitehead, because initially the sebaceous gland will stay below and it forms a bump with a white center. Subsequently, when it opens up, it becomes a blackhead, because when the sebaceous secretions, the oil secretions, they get exposed to the atmosphere, because of the oxygen in the atmosphere, they get oxidized and it forms a black plug here, that is a blackhead. Subsequently, these blackheads and whiteheads, they can become larger, they form papules, they may form small inflammatory abscesses, they can form cysts. And all acne lesions, the biggest problem is they heal with scarring. They are not uniform in all age groups, they are not uniform in all people. Who gets more acne or who gets less acne largely depends on the genetic makeup, their hereditary, and as well as their lifestyle. It is one of the lifestyle diseases. Those who tend to neglect their acne, the acne will continue to grow. But early treatment and early consultation with a doctor, especially dermatologist, will go a long way in preventing their scars, which can be both physical as well as on the psyche.
Doctor, what can cause acne?
Yeah, as I hinted in my talk just now, acne is primarily because of hormonal changes in the skin. There are sexual hormones include in the female progesterones and estrogens. They are responsible for development of secondary sexual characters, like the development of hair in the sexual region, that's armpits, axilla and groins, etc., for enlargement of breast and so on. Similarly, there are male hormones, that is testosterone. This testosterone is the one which stimulates the sebaceous glands. And testosterone, unlike people may think that testosterone is a male hormone, it is only present in males. No, testosterone is present in males as well as females. Only in the females it is a much lower level. When there is an imbalance in the testosterone and estrogen and progesterone, that is when the acne develops. Plus, progesterone itself also stimulates the sebaceous glands. So, with the interplay of these hormones, which keep changing during the pubertal growing up, this is the one which ultimately results in acne.
Doctor, did stress can affect acne?
Of course, stress of any type, whether it is physical stress or mental stress, affects acne. Because any stress, after all, embryologically, if you see in development, when the child develops in the mother's womb, the skin and brain develop from the same tissue. So whatever affects the mind will affect the skin and vice versa. And any type of stress, whether it is mental stress, whether it is physical stress or pollution, sudden changes in temperature, all these will affect uh, acne, and it will affect the hormones, and in turn the hormones will affect them.
Doctor, how patient can determine if they have acne or any other skin condition?
A good question. As I already told, it starts developing during puberty because of the overactivity of sebaceous glands. Now, these sebaceous glands, they are located all over the body. However, they are concentrated on the face, on anterior chest, on middle of the back, shoulders, and so on. Now, any pimples or lesions occurring in these areas during the growing up period, one should look out for acne. Whereas normal boils, etc., can develop anywhere in the body. Whereas acne will develop in the preferential areas, where those areas which hold the sebaceous gland is maximum.
Doctor, what lifestyle changes patient can improve for their acne?
Yeah, the lifestyle changes. Nowadays, earlier on, we used to have all natural food stuff, more of vegetables, more of fruits, more of whole grains. But gradually, we are shifting towards, or rather, I should have said, over the last 3 decades or so, we have shifted toward more towards highly processed foods, which contain a lot of additions like preservatives and all. All these can affect acne. For lifestyle changes, I would suggest go low on processed foods, or better avoid them altogether. Certain foods like cheese, etc., tends to increase acne. Not that if one has a slice of cheese in a day or something in a week, no. But if one tends to survive on pizzas or only cheese toast all the time, acne is likely to flare up. Plus, milk. Cow's milk contains certain substances which can increase the development of acne. However, this will not happen if one has a cup of milk in the morning or something. But some people, especially vegetarians, tend to have more milk. Especially if it is cow's milk, it can give rise to exacerbation of acne.
Doctor, is acne is a serious problem?
In the large majority of children and growing young adults, it is a minor problem. One odd pimple comes, it heals by itself. But in some, because of their genetic makeup and hereditary and all that, and the hormonal set makeup of the body, they may develop excessive acne. And this excessive acne impacts not only the physical well-being, it also affects their psychosocial well-being, because they feel embarrassed to go out and meet their friends, go out easily. I have seen so many of my patients come in with the face covered like a tug, totally masked, because they are unable to face the world with it. Yes, it does. It can have a lot of psychosocial impact. And plus, if not treated promptly, untreated acne can give rise to deep scars, and these scars are very difficult to treat. If early acne is treated properly, it may not leave scars at all. But treatment of developed scars, at best, 50% successful. There are a lot of treatments, there are lasers and so many, so on and so forth, peels and everything, but the skin can never come back to the original status. So one should prevent and treat acne as earliest as possible.
Doctor, when should patient consider seeing a dermatologist for their acne?
If it's very early, one odd small pimple coming up and drying up on its own, they can try some home remedies or over the counter remedies. But if, or very often seen, young women will have a premenstrual flare, that is about a week before the period. They tend to have one odd pimple that may or may not require treatment. Just over the counter medications like some clindamycin gel or benzyl peroxide they can take. They are available over the counter and they can use it. And just cleans the face twice daily with a mild cleanser, no scrubs. A lot of people do a lot of scrubbing. As I explained right in the beginning, the scrubs tend to remove the skin, loose skin from top, and this skin can glow and clog up the pores, and it will worsen acne. So scrub should be avoided, and gentle cleansers, non-oily, should be used at least twice daily, and they should avoid dusty atmosphere. If they happen to go out to play or something, should come back and wash your face. The soap or the cleansers need not be used more than twice daily, but just plain water wash is sufficient.
Doctor, can certain medications or medical condition can affect acne?
There are certain medications which not everybody will not be taking. Like a person will have uh, anti-tuberculosis treatment or certain psychiatric medications. They develop acne-like lesions, but they are not true acne. But acne can occur in conjunction with other conditions. Like there are certain syndromes, like a woman having hirsutism, acne, and insulin resistance, obesity. This is a constellation of symptoms which occur in some women especially, and they require specialized hormonal treatment and complete checkup.
Doctor, how to prevent acne flare-ups during menstruation?
I alluded to it just a while ago. Cleanse the face twice daily with mild cleansers. Have plenty of water. Avoid processed foods. Maintain a healthy weight. As I said, the higher the weight, the insulin resistance sets in, and that causes more acne. So, regular exercise and proper food. Proper food means more of fruits, fresh vegetables, less of processed food.
Doctor, for pregnant women, acne treatment, is it safe?
By and large, anything acne can be treated both with topical remedies as well as oral antibiotics and certain medications. In pregnancy, as a rule, we avoid anything oral. However, there are certain medications, some antibiotics like erythromycin and normal cleansing, they can be given during pregnancy and can be used. Primarily during pregnancy, one should maintain good cleanliness and washing face twice daily, avoiding or no smoking. Smoking as such is bad for pregnancy, and smoking has a deleterious effect on acne of any age. So smoking should be avoided at all costs. And rest healthy food, and some medications, topical medications can be given.
Doctor, how is acne treated?
Well, there are certain general measures and specific measures. The general measures include regular cleansing of face with a non-oily, non-irritating cleanser, and good exercise, regular food habits. Nowadays, especially with so much of uh, IT people and they have abnormal working hours and all, that also affects acne. Exposure to pollution, excessive exposure to sunlight, all these will cause a problem. So one should use, apart from cleansers, regular usage of sunscreen and a non-comedogenic moisturizer. By non-comedogenic, what we mean is something which is not oily, because oil blocks the pores. That is where the problem starts. So these are the general measures. And of course, looking after the weight, not to binge, avoid smoking, avoid alcohol. Apart from that, specific measures are topical measures, which include antibiotics, some antibacterial creams like benzoyl peroxide, antibiotics like uh, erythromycin and clindamycin, plus certain vitamins like niamycin, nicotinamide cream that helps. Zinc, topical zinc helps a lot in putting down the acne. But when the topical creams are not sufficient, apart from these, we have topical retinoids. Retinoids are nothing but an analog of vitamin A, which is important for our eyesight and proper balance of the skin. These retinoids are applied to the skin. So these are the topical. But when it is beyond the scope of topicals, as determined by the dermatologist, we tend to add, we would add this antibiotics in the initial. Subsequently, apart from antibiotics, oral retinoids can be added. In women, where the hormones are affected, we check up whether there is any problem in the hormones. Some hormonal treatments, including cyclical oral contraceptive pills and all, but they are in very severe cases. These can also be given.
So viewers, hope so we have covered all the queries regarding acne. Still you have any doubts about acne, kindly mention in the comment box.